invisible organisms cause disease wasn't accepted the whole world over. And so that shaped people's behavior in a very powerful way, and you see that varying enormously across the globe.
So those differences in understanding will persist, albeit in different ways today. Does that suggest then the message, how you actually communicate with people, has to vary quite radically from country to country?
If I can come in on that, that's really critical. And one of the lessons that I learned from Mohamed Jallow in Sierra Leone, who helped turn around the curve there, was that good communication is about getting the correct messages out, but also correcting the incorrect messages. So you really have to understand what people's beliefs are and what they're thinking, which is one of the advantages of social media. You do understand the misconceptions. But the other really important thing is that the messenger is often much more important than the message. So the outbreak in West Africa got turned around once they engaged the 4,000 market women, the 20,000 traditional healers, so that people were hearing the prevention messages from people they trusted. And that is so critical. You can't just talk with a megaphone from the capital city. You really have to build that chain of trust.
Laura?
I was just going to say that, the other factor that plays an important role is recent memory. So if you think about the countries that are being held up as models of containment or disease control at the moment, they are Singapore and Hong Kong. And both of those places have powerful and frightening memories of the SARS epidemic in 2002-03. And I think in the meantime, they've not only been bolstering their health infrastructure, the population is more inclined to comply with public health measures because of what happened before. And also the government, I was just speaking to someone in the Ministry of Health there the other day, who was saying we think it's very important to have a cross-government message. Everyone's working together. So when they raised the disease outbreak alert level a couple of weeks ago, it was the Prime Minister who announced it. And I think that might be one of the things that, because we don't necessarily have that sense of urgency in the West, has been lacking a kind of consistent message, a consistent approach from the bottom up and the top down.
And I also think, too, there's variation across national political cultures in general, and also as it relates to disease. So in Canada, you may have more of a communitarian national political culture that focuses on good government, peace, and order, versus in the United States, where we have an emphasis on individualism and wariness towards government. And we can contrast that, thirdly, with, not to overstate it, but what people have referred to as that Dunkirk spirit in the United Kingdom, was sort of tapping into that willingness to abide by and amplify and cooperate with state campaigns about emergencies.
I want to explore that relationship, if you like, the social contract, the relationship between people and the state a bit more. But before we do that, Stephen Taylor, do you think that it's dangerous to treat any community, even if you get down to a specific community, as a single entity?
Yes, it is, because there's great heterogeneity, not only across communities, but within communities. There's always some people who think the outbreak is overblown, exaggerated by the media, and they're the people who are less likely to wash their hands, they're less likely to comply with recommendations for self-isolation. And then there are other people who react with excessive anxiety, and they might be more likely to adhere to restrictions on their freedom, such as self-isolation.
I'm interested also in the point that Monica just made about the Blitz spirit. There is an inherent contradiction there, though, isn't there? Asking people to pull together when actually what you need them to do is to be alone.
Well,
yes, it is.
Actually, I think that medicalized emphasis on individual personal hygiene, as important as it is, detracts from the larger message of solidarity and social forms of mutual aid that are absolutely essential in periods of contagion. So just to get very concrete, the CDC in the United States has asked frail elderly people to avoid public places and to stay in their homes. Now, people like their neighbors or people from their faith community can step in and say, I'm going to bring you groceries and supplies, and I'm going to visit you so you don't feel socially isolated. That is a very different message than wash your hands for 20 seconds, wipe down surfaces that see a lot of traffic. So I think the individualist focus on personal hygiene, as important as it is, needs to be coupled with the focus on these social forms of mutual aid.
Stephen Taylor?
Well, it's complicated, and it's important that people don't see this as a mixed message. You have to be alone, but you have to be connected too. And what makes this pandemic different from previous ones is it's a pandemic in a digital age. We're all interconnected, and social media has an important role in providing social support, even if a person is in lockdown or is in quarantine or is in self-isolation.
So you can still speak to people. Let's think about this relationship between the public and the government a bit more. How do you get people to do what you want? What people must do then if the virus is to be contained? There are two obvious examples we've seen so far. China, which after a start that was sort of mild in denial, obfuscation and perhaps even some downright untruths, then imposed a draconian lockdown which brought the virus under control. And then there's been the more chaotic approach in Italy. Let's just hear from Italy's Prime Minister Giuseppe Conte, who did put the country into lockdown on Monday.
E per questo che sto per firmare un provvedimento. I'm about to sign a decree that can be summed up as I stay at home. There won't be a red zone anymore. There won't be a zone 1 or zone 2 of the peninsula. There will be Italy. All of Italy as a protected zone. That means that people across the whole country shall avoid movement unless motivated by 3 specific circumstances: important work reasons, extraordinary circumstances, or health reasons. O anche per motivi di salute.
Now, Italy's still reeling from that message, but Jonathan Quick, how effective can it be for Italy to do something like that compared to China?
Well, if it's a question of whether you have the choices, I have to say that I think what China has been able to do, given the magnitude of the outbreak there, the speed with which they have brought that down, we can quibble about some of the individual numbers, but the upward trend and downward trend are really clear and really dramatic. So it worked for them there. There was loss of freedoms and all. But that's a different culture with a whole different structure.
Monica Schock-Spanner, how difficult is it to persuade people to have trust in their governments in freer societies?
Well, I think the larger issue is, does government emergency planning build off of realistic assumptions about human behaviors? In these types of events, people are going to be faced with potential barriers, practical barriers to implementing what public health authorities are requesting. So if it keeps people from going to work, particularly among classes of people who live on a day-to-day basis, it's going to be more difficult for economically challenged groups to implement some of the social distancing. And if there are practical barriers, then let's remove them for people. And I was very glad to see that there is bipartisan support for wage relief and also extending unemployment insurance during this period of crisis.
Laura Spinney, how difficult is it to get people to trust their governments and to do what they're being asked to do?
Well, I was just thinking, listening to the others, that we value our human rights, of course, in the West, but if you don't impose public measures in the way China has, you have to hope that your population will, comply voluntarily, and they'll only do that if they trust their government. There's some very clear examples from 1918, for example, of where they didn't and how that manifested once the pandemic hit. So, for example, in South Africa, vaccines were put together very quickly after the pandemic struck in the autumn of 1918, and they weren't very effective because they were to the wrong microbes, but nobody knew that at the time. And they launched a national vaccination campaign, and all the white South Africans lined up dutifully for their vaccine, and black South Africans pretty much largely boycotted the campaign, quietly just didn't turn up. And that's because until then the government had shown very little, if any, interest in their health, and they became suspicious about why the doctors were wanting to give them injections now, and there were rumours that circulated that the doctors were trying to kill them. So you see that by the moment the pandemic breaks out, if the trust isn't there between people and the state, and unless you have the powers to impose your measures from the top down, people are just going to desert, and you can hardly blame them. So the lesson, I think, there is that the trust has to be in place when the pandemic declares itself. So that's a long-term task, obviously.
Stephen Taylor, if there's an absence of trust, the absence perhaps of a public memory of a similar situation, how much harder is it? And perhaps some of that lies behind Italy's apparent inability to really knock this on the head.
Well, trust is essential. The public needs to have trust in the government and to be knowledgeable about the situation. I think one of the issues with highly individualistic societies is if that you impose something top-down on them, you'll get something called psychological reactance. That is a kickback. And we saw that in Canada when they tried to enforce vaccination. There was a massive kickback from some segments of the population because this encroached on their freedom. So I think if the government is going to impose restrictions, lockdowns, ask for self-isolation, they have to deliver the message in a way that's not authoritarian, at least in individualistic societies, but in a way that encourages people to be doing it for other members of their community, to elicit their sense of altruism.
So is there any lesson to be learned from how China, in a sense, operated?
Well, that's an interesting question. The culture there is very different from, say, Western societies. I would think in the more individualistic societies, if you imposed self-isolation, you would get this kickback, because self-isolation, just like quarantine in general, can be stressful and boring, and many people will not adhere to it if they feel like it's being imposed from above. They need to get the message that they're doing it for the rest of the members of their community.
Jonathan Quick, would you agree?
Well, I think it shouldn't be simply coming from above with something that's just been put together by government. And if we look again at the example of West Africa, it was when they brought together all the segments of society and actually got agreement and got a working group. So what's missing is bringing together the business community, the social sector, the religious community, and actually having a cross conversation. My perception, at least in the U.S., is that there have been individual government to the business, government to other, but you're going to get the best solution if you come together.
Hold that thought. We have to take a short break now, but just to remind you, if you enjoy this programme, do subscribe to our podcast. Search for BBC The Real Story in your preferred app.
This is the BBC World Service, where the incredible story of the doomed Apollo 13 moon mission continues.
The explosion reverberates through the spacecraft.
Okay, Houston, we've had a problem here.
In the cabin, a master alarm sounds. Scores of warning lights flash up.
I knew we were in deep, deep trouble.
Mission Control can barely believe what they're seeing, let alone understand it.
That can't be.
The chaos and confusion begin.
Nothing made sense in those first few seconds.
Stand by, 13, we're looking at it.
You know, you get the cold feeling in the pit of your stomach. This is really bad.
2 of the 3 fuel cells are down, and the spacecraft is leaking oxygen.
It's going down, we're losing it.
The truth is beginning to dawn.
We're not going to the moon anymore. We're going to just be lucky to get home.
We were not confident we were going to get the crew back.
Apollo 13 with Kevin Fong. Wednesday at 11:30 and 23:30 GMT.
Coming up on The Real Story in the next half hour, the rapid spread of the coronavirus has become a global emergency. But how do governments win the trust of sceptical populations and persuade them to give up long-established freedoms? Will temporary changes to lifestyle become permanent? And in an age of individualism, how much are we willing to do for wider society? Beating coronavirus, how much are you willing to sacrifice? That's all after a summary of the news.
BBC News with Fiona MacDonald. President Trump has declared a national emergency over the coronavirus outbreak. He said this would give the government access to up to $50 billion in emergency funding. The president also confirmed that he supported a new package of relief measures agreed with the Democrats to be voted on shortly in the House of Representatives. These include paid sick leave, food stamps and unemployment benefits. Schools are being closed in more places in the United States to try to limit the spread of the virus, including Los Angeles and the state of Illinois. Several European Union countries have said they'll close their borders to most or all foreigners because of the virus. They include Denmark, Poland, Cyprus and Slovakia. A number of the countries, including the Czech Republic and Greece, have announced the wide-ranging closure of public spaces, including shopping malls, cafes and restaurants, for up to 2 weeks. In Hungary, the Nationalist Prime Minister Viktor Orban has announced the closure of all schools, reversing his previous decision to keep them open. He'd earlier said that only universities would close because, as he put it, they had so many foreign students. In Spain, Prime Minister Pedro Sanchez says a state of emergency will come into effect on Saturday after the country recorded a 50% jump in fatalities. And in other news, Chile's Minister for Women, Isabel Pla, has resigned after months of criticism over allegations of sexual abuse of women detained during anti-austerity protests last year. Rights groups allege that she ignored their accusations that security force members raped them and frequently forced them to undress. Microsoft's co-founder Bill Gates is stepping down from the company's board to spend more time on philanthropic activities. He says he wants to focus on global health and development, education and tackling climate change. BBC News.
You're listening to The Real Story from the BBC World Service with me, Rithala Shah. This week we're asking what we have to give up if we're going to get Covid-19, the coronavirus, under control. We're joined by Dr. Monica Schock-Sparner. She's a medical anthropologist at Johns Hopkins Bloomberg School of Public Health in Austin, Texas. Also Dr. Jonathan Quick, the author of The End of Epidemics and a former director at the WHO, is online. Laura Spinney, novelist, science journalist, and author of Pale Rider, A History of the Spanish Flu, and Dr. Stephen Taylor, author of The Psychology of Pandemics. Welcome back, everyone. Now, we've been talking about persuading the public to do what's in their interest, but what if the public simply refuses to trust the experts? It could be because they have evidence that the experts have been wrong in the past, or it could be because they've chosen to believe unsourced facts that are circulating among friends or on the internet. And skepticism of experts, and frankly science in general, isn't new in the United States. We've been hearing from the science journalist and the director of the Center for Science Writings at the Stevens Institute of Technology in New Jersey, John Horgan.
We're kind of a rebellious lot over here, and even though science took root pretty early here, maybe a little bit after it did in Europe, but still by the 19th century science was a big part of our culture. And yet, even going back to the 19th century, there was skepticism certainly about the theory of evolution on the part of many religious people, so that's always been there. I grew up in the 60s and 70s, and back then I'd say anti-science skepticism was strongest among people who were in the counterculture or who identified as left or liberal. So, for example, there was a lot of skepticism about whether nuclear power was a good thing. And a lot of people in my generation associated science with bad things like militarism, the Vietnam War, nuclear weapons. What's happened since I've been a science journalist, and I started writing about science in the early 1980s, is that skepticism has become even stronger on the political right, especially when it comes to climate change.
The scientific consensus is that we are causing global warming. I am Al Gore. I used to be the next president of the United States of America.
If you go back to the 1990s, even Republicans like Newt Gingrich believed that climate change was a serious issue that we had to do something about. Shortly after 2000, possibly because Al Gore was such a strong proponent of taking measures to combat climate change really became politicized. And since then, it has been something that you decide is genuine or is bogus on the basis of your political affiliation.
I vaccinate because I'm a pediatric ICU physician. I've had multiple kids die or need the ICU for vaccine-preventable diseases.
My family vaccinates.
Yeah! Vaccines are imperfect. I mean, there are always a small number of people who react badly to vaccines, but overwhelmingly, vaccines have been a triumph of public health medicine and science, there's also a conflict between what's good for the individual and what's good for the group. And so going back 20 years or so, you had some people who seized on the idea that vaccines for children, for certain infectious diseases that children have just been getting as part of their normal routine, some people have worried that those vaccines were dangerous. And so that's been part of a movement in this country. And it's become quite deep-rooted, and it's actually led to measles outbreaks and some other difficulties. And I think there are a lot of reasons for this. The internet has certainly made it possible for people who have doubts to get together and to share information or misinformation. So I think some of these anti-scientific trends, which have always been simmering in the background, have become more significant over the last 20, 25 years because of the power of the internet to get them all united together.
That's John Horgan, who writes for The Scientific American. Monica Shock-Spanner, we were talking a few moments ago about the need to get a buy-in from all of society if you're going to make a real change, if you're going to get on top of a virus. But how dangerous is this growing mistrust of experts and the ability to share those ideas on the internet?
We do have to be very cautious about the growing anti-science movements that take very local manifestations across the globe. And I'll allow others to expand on that. I did want to share a complementary perspective, which is science is not the only form of knowledge that will provide us good adaptations and coping devices for periods of outbreaks or the pandemic we're seeing now. So, for example, we spoke with members of communities that were affected by Zika, and we posed the question very specifically: if you were faced with two competing scientific ideas, on the one hand, that aerial spraying could help contain adult mosquitoes versus aerial spraying could introduce a toxin into the environment, if you had to pick or choose about who you believe more when both were quoting the science, we discovered something very interesting. A large number of people, now this is in the United States, a large number of people said they would rely on their religious belief system to make a choice. And what was interesting is many people in our focus groups indicated that they would be motivated to adopt a public health intervention not based on the scientific arguments alone, but on moral-based arguments. Now, public health, under our professional ethics framework, are enjoined to share the science behind the importance of a public health intervention. At the same time, there is morally based discourse that can also be circulating and should circulate during outbreaks of infectious disease. So to quote one woman we spoke to, she says, I may not want to be in a community where there is aerial spraying of a mosquito or insecticide, but I have to worry about the least, the last, and the lost. So I'm going to put my anxieties on the side so that other people, like landscape workers who are always outside, or the homeless who can't afford mosquito repellent, have a better chance of not being infected. So I think there's a moral discourse that we need to make room for in public health.
Laura Spinney, I'm going to bring you in because there's an obvious comparison, I think, with 1918 probably there.
Well, I have to say that I don't really understand that. I mean, for me, science is not a system of knowledge. It's a method for acquiring knowledge. So if you were to give the example of spraying an insecticide, you wouldn't take, I presume, a public health decision to spray that insecticide unless you'd weighed up all the available evidence, and then you present that evidence, and you make a decision on that basis. It's at that point that you can start discussing the moral elements. But, I mean, you're not going to be presenting the public with two alternative scenarios.
But what about the role of religion, for instance, in society, both in 1918 and indeed today, in the way in people...
Well, so one of the things that's been remarked upon is how much more of a role organised religion played then than now, which won't surprise you. But, for example, I can tell you the story of Zamora, which is a town in northwestern Spain, where the local, it was and is a very Catholic, very religious city, and the local bishop basically defied the provincial authorities and said, no, we're not going to do any of these public health measures. I'm ordering my flock into the churches, and he commanded at the peak of the epidemic in the autumn of 1918 a novena, which is prayers on 9 consecutive days, and people went into the churches. They kissed the relics, the holy relics of the saints of the Saint Rocco, who's the patron saint of pestilence and plagues, and Zamora eventually recorded the highest death rate from the flu in Spain and one of the highest in Europe.
Jonathan Quick.
One of the admonitions in many faiths is love your neighbor. And so if you take that into the conversation we had earlier about older people, you love your neighbor by not exposing them if you've been exposed, but you also love your neighbor by finding a way to serve them. And so I think you can, there's ways of delivering food and bringing things to elderly people out of that love that let you keep your 6-foot distance or 3-foot distance, that do it in a safe way. I think that faith foundation is really important. Little bit different example, trying to promote family planning in Islamic Afghanistan. The mullahs and imams weren't interested in family planning, but the Holy Quran says you need to have healthy children. And when they understood that spacing births led to a healthier mother and healthier babies, they got on board, and they helped increase family planning and put the messages out.
And what about skepticism of science, though? So if you accept that there is a role for religious belief or taking account of people's beliefs to sit alongside any kind of messaging, is skepticism, though, of science really quite detrimental?
Well, no, I mean, I don't see them in conflict. And many people, the head of the NIH is a strong believer. I believe that God gave us the ability to create vaccines, to create family planning. I think it's all part of our obligation for care of the earth. I mean, I'm not Catholic, but Pope Francis has this care of the earth concept.
But then where do vaccines fit into that kind of conversation, where you've got people who simply won't, for whatever belief system they may have, they won't take up the offer of vaccines?
That is a stunning dynamic and a good example of the long tail of a lie, because the vaccine autism myth goes back 20 years. That community has been incredibly effective, and the footprint of that belief is worldwide and causing us measles outbreaks. But here's the challenge. There's a dynamic called the Backfire Effect, which social scientist Brendan Nehan has recognized. When people hold on tightly, ego invested in a belief, however they got the belief, when you confront them with facts, they hold on to that belief even tighter. The key thing is they're going to be convinced by the people they trust. So, for example, when we had an outbreak of the biggest flu outbreak a few years ago, 80,000 deaths, and we started seeing deaths among children, it was the mothers who had not vaccinated their children and who realized the difference and said, I should have vaccinated. When those mothers started speaking out, then they're much more credible.
So, Stephen Taylor, if I can bring you in, how do you think that the psychology of this messaging works?
It gets at this critical question of what motivates people to do the things that they do during times of pandemic. During times of pandemic, there's a lot of uncertainty. People are seeking ways to keep themselves safe. They want to try and do things. And in some circumstances, they might override their natural skepticism of science to get vaccinated, for example. Or in some cases, they may follow religious leaders who advise them to get vaccinated. Or in other cases, it could be just so simple as imitation or a herd effect. We've seen the recent rushes on purchasing toilet paper, and you interview these people when they leave the stores with big packets of toilet paper and ask them, why did you do it? And some of them say, I don't know. I did it because everyone else was doing it.
It is mind-boggling. Why do you want to stockpile loo paper?
It's fascinating. There's an internal logic to it. When people feel threatened with infection, what is called disgust sensitivity increases, because disgust is an emotion that keeps us away from pathogens. It's like an alarm system. I'm not going to eat a piece of rotting meat because I feel disgust, and that will keep me safe. Well, think of toilet paper. Toilet paper is the tool for removing or avoiding disgusting things. And so at times when people feel threatened with infection, their readiness to feel disgust is elevated, and there's toilet paper to the rescue. It's become a symbol of safety.
Toilet paper to the rescue. There's a phrase I never thought I'd hear. There's a story at the beginning of all of this that fascinates me, which was about an American who was evacuated from Wuhan when the coronavirus was spreading there. He was then returned to the United States, placed in quarantine in California, and tried to leave the base where he was being asked to self-isolate. What does that say about us as a society, as our willingness to make personal sacrifice for the greater good?
We were talking earlier about bringing the different communities together and getting them to come up with the same sort of preparedness plan, the same message. And I think there is huge spare capacity there. And one of the things you saw in 1918 was, and again, as we described earlier, counterintuitively, this kind of thing that psychologists refer to as collective resilience. So people reaching out to help each other, even though it wasn't necessarily the rational thing to do. And Jono referred to this in Liberia with a far scarier disease, on paper at least, Ebola. And I think we can tap into that to a much greater extent. But it is true that there will always be deserters. This is just what game theory teaches us. And I think that they are in the minority, generally speaking, and that it doesn't necessarily reflect on the particular culture they come from. We in the UK, like Singapore, we have actually a law which allows us to punish the people who do that, who break quarantine, for example, or who don't come forward with the right information about contact tracing at the right time. So we have those kind of heavier-handed ways of dealing with people like that. But obviously the better way is to get people to want to abide by their social responsibility, want to think about others, and to, as I said, again, tap into that collective resilience.
I agree with Laura. I think in past pandemics, what's been striking has not been this chaos and mayhem. It's been people pulling together and people working to help other members in the community. And we're seeing a lot of the individualistic behaviours that have gone viral on social media, the panic buying and so forth, because they're dramatic. But I'm hoping that, just like previous pandemics, we're going to see a lot more prominent pro-social behaviour.
Monica Schock-Sparner, do you feel confident that we'll see better behaviour?
Yes, I do. I do want to build on the topic that Laura introduced, which is the issue of coercion, the avoidance of or the actual use of coercion in public health campaigns for managing infectious diseases. And as much as we pay attention to those psychological elements, I think we still need to make room for the sociological. So there's a great piece of medical history by a historian named Judy Leavitt, and she compares the reactions of Milwaukee, Wisconsin in 1894 to a smallpox outbreak to the response of New York City in 1947. So in Milwaukee, you had month-long rioting because the public balked at the use of isolation and vaccination as a way to contain the outbreak. They had over 1,000 cases and 250 deaths. Now, if you compare that to what happened in New York City, you had, in terms of public health outcomes, 12 cases, 2 deaths. And you had millions of people literally lining up in an orderly fashion, waiting to be vaccinated. So here we have the same very frightening pathogen, right? Because smallpox kills, it blinds, and it disfigures. And it kills 3 out of 10 people that it infects on average. So what made the difference between the Milwaukee experience and the New York City experience? Well, in Milwaukee, the health officials forcibly removed infected people and took them to isolation hospitals. And they only used force among impoverished immigrants. Thus, you had rioting because of the authoritarian approach to containment of that outbreak. At the same time that impoverished immigrants were being forcibly removed to smallpox hospitals, isolation hospitals, you had wealthier citizens in Milwaukee being allowed to be quarantined at home, and if they had an infected family member, they were allowed to take care of them in their own home. You have public resistance in the context of authoritarian and uneven application of public health interventions. New York City, very different. They involved community groups in organizing and delivering vaccination. They had a massive public education campaign, and it was evenly handed. New York City at the time had legal authority to forcibly remove people to isolation and also to forcibly vaccinate, but they did not exercise that right.
How does that story compare to what we've seen in China in recent weeks? Are there any lessons to be drawn, and could what China has done be applied in any way in a Western liberal democracy in the United States or in Europe?
As someone who's not a citizen of China, I don't feel the most apt to deliver that assessment of one's government. As an outsider looking in, we have a centralized government with a history of heavy-handedness in a culture that does elevate the collective well-being among individuals. So you have public health interventions being introduced into a certain political environment and cultural environment. And there are forms of resistance, including millions of people who left Beijing before the quarantine was put in place.
Jonathan?
Well, I think the key thing is the strategy for trying to get the public cooperating, if I can use that word, following the public health advice at all, depends on the culture. So China did what it was able to do. I don't believe that would work in the Western Europe or here. So the thing is, now one of the things the internet has done is create a whole variety of different communities with opinion leaders. It may be influencers on social media. It's the talk radio hosts in many places. And I believe that our effectiveness in fighting this pandemic in free societies is going to depend greatly on engaging those opinion leaders, not online, but engaging those opinion leaders in a way where you can have the conversation. Because if they become convinced, those that may be skeptical about the response and what needs to be done, and then they take the leadership, with their own community and being the face and the voice for that community. I think that's really critical